Good evening to all the chairpersons of the portfolios that we who will be presenting their reports today of the budget votes, who are here with us this evening. That is Honorable Dr. Rebecca Paladi de Jamela. Good evening to you, ma'am.
Good evening.
She's looking after Department of Health, and we are also welcoming Honorable Matume Chiloani. He is looking after Gauteng Department of Gauteng. Good evening, sir, and welcome to the budget vote session. Your microphone, sir. If you can just switch on your microphone up there.
I was saying that it's the Department of Education. We just said Department of Gauteng.
Oh, blame it on being nervous. Gauteng Department of Education, yes. And we are also going to hear a report from the Finance Portfolio Committee as led by Honorable Joe Mpisi. He is here with us. That's a report from Gauteng Provincial Treasury. Good evening to you, sir. The microphone, sir, if you can just switch on the microphone, Honorable Joe Mpisi.
Okay. Good evening to you, Hector, and the colleagues. I'm happy to be here.
Thank you. It is the Budget Vote webinar sessions, and we just want to welcome the listeners of the 4 radio stations which are joining us this evening. I have them as EKFM, that is Eko Ruleni FM. We have Lekwa FM. Lekwa is in the Val somewhere, as well as West Side FM, somewhere in the East Rand, on the West Rand of Johannesburg. And we have Cosmo FM listeners also here with us this evening, as well as those of our hosts, the Mail and Guardian, who will be watching via YouTube. And those who are watching using this very platform where we find ourselves. So we welcome members of the public who have registered and are here and have interest in what will be said here tonight. And this is sponsored by the Gauteng Provincial Legislature, which is responsible for making the laws in the province. It's the smallest in terms of size, but yet the biggest economy is here. The biggest budget of the country resides here. So they're responsible for making the laws, oversight, corporate governance, and public participation. And this webinar here speaks to that mandate as well of public participation. Now, after the presentation of the reports, we are going to ask you as members of the public to, while they are presenting, while the chairpersons would be presenting, please do type your questions on the platform here so that we can read them out to the chairpersons who will be listening and will be ready to take your questions. So this session will run from now until 7:30 this evening. But before, let me just give you a quick background. Just bear with me as I give you this background here. It says, as part of implementing the Gauteng Provincial Legislature's oversight and public participation mandates, portfolio committees have recently undertaken a process of scrutinizing budget votes of the provincial government departments and the Gauteng Provincial Legislature for the 2021-2022 financial year. During this time, portfolio and standing committees assess the annual budgets of provincial government departments, which highlight budget allocations against their annual performance plans. The process includes a determination and assessment of the department's performance against the priorities identified in both the State of the Nation Address, which is known as the SONA, and the State of the Province Address, the SOPA, as they relate to government departments. The aim of the 2021-2022 budget vote analysis is to provide committees of the legislature with an opportunity to scrutinize the budget allocated to the departments. This analysis insists or rather assists the committees in making decisions of whether the allocated budget of department is in line with the planned performance targets as outlined in the department's APPs. It is imperative that this analysis reveals whether the budget allocation and the APP remains aligned to the provincial priorities as outlined in the State of the Province of 2019, when the sixth administration came in, of course, for the 5-year political term. The current financial year budget allocations of departments come at a time when the nation is seized with an enormous responsibility of combating the COVID-19 pandemic and its social and economic impacts on society. I mean, just this week from Monday, some of our members here in the Gauteng Provincial Legislature were affected, as we know, some having family members, some personally affected, and also the province heavily hit by this, and that the third wave is currently pounding the province. And this has led to many budget cuts to department and stringent allocation of resources. All of this will have some negative impact on service delivery and the implementation of the province's growing Gauteng Together 2030 strategy, GGT in short, GGT 2030 strategy. It is thus important for committees of the GPL legislature to pay close attention to budgets of departments and how they are spent to ensure there is minimal impact on very key phrase, service delivery. And this is what members of the public and what the listeners of all those stations that I have mentioned would be very much interested in. The key word there is service delivery. So Gauteng province being such a big province with so many challenges, so many needs, so many people. We were saying earlier on with Honorable Joe Mpisi that, Gauteng is one province that hosts all the provinces. Sometimes people come into Gauteng over the festive season and just decide to stay over and they're not budgeted for maybe, or, so yeah, facing a myriad of challenges. Now, with that being said, ladies and gentlemen, we're going to give you an opportunity to present your reports, and please put special emphasis for the members of the public, because we're interested in knowing how are their monies, how their taxes going to be spent in this current financial year of 2021-2022. We're going to start with the report on the 2021-2022 as presented by Honorable Dr. Rebecca Paladi Dikhamela. And I'm made to understand that your department actually has got the lion's share of this 143 billion budget of the entire province. You got the lion's share of 56 billion. Let me not steal your thunder. Let me give you an opportunity. And we are very much aware, and I know that the public will be listening with the ear of knowing the challenges, which have been very much public, and everybody knows about those have been in the media. So we are listening with that ear, and the public very interested in knowing how we're going to be dealing with all those challenges. Honorable Dr. Rebecca Paladi Dikhamela, the stage is yours.
Good evening to you, Hector, and the listeners of this webinar organized this evening. Thank you very much for this opportunity that I will share with the residents of Gauteng what we do as a committee. Our role as a committee is to do oversight over the department, and our job is legislated. It's also constitutional. So what we do, we are guided within the parameters of the South African Constitution, and also legislature has got rules that are guiding our operations. We do oversight, we do public participation, lawmaking. Those are the main duties that we do. On the oversight of the budget that I will be talking about tonight, yes, the department was given the budget of 56 billion to run this Department of Health in our province. This Department of Health has got 8 programs that they are running the whole year, every year, and there are targets that will be put under each program. The first program will be administration. The appointments, the HR, all those issues will be falling under administration. This budget, which was 56 billion, in this financial year that we are talking about, the Department of Health in Gauteng spent 98% of this budget, and there was only 2% underspending of this budget. So we do commend the department, but our wish as a committee is for them to spend 100% every year. So as I was talking about the programs that are run by the department, the second one will be the district health services. This is where you have your primary health care issues. As you know, we encourage our people to all the time start at the lower level of care before they go to the higher level of care. We continue to educate our people because we don't want people to wake up in the morning and find themselves in the hospital, and yet they have the clinic, the local clinic that should be referring this person. So that budget was given also for the district health services to cater for our people when they go to the primary health care services. So if they do not go there, then they are missing the opportunity to be given health services at the clinic. The other program will be emergency medical services, our ambulances within the province. So this budget also cater for emergency medical services, which our communities use. The fourth one will be provincial hospital services. A province of Gauteng has got hospitals that it is running. So the budget also is catering for those provincial hospitals. You can name them according to, we've got 5 districts. Your Tshwane, your Johannesburg, your Ekurhuleni, your Sedibeng, your Western. Every district has got services that are being provided in all those hospitals for our people. The other program will be number 5 is central hospitals. There is also budget allocated for central hospitals. As a province, we've got large number of central hospitals concentrated in our province, and the catering is not only for the people of the province, it's for people inside and outside our province, including outside our country. So this budget also caters to people who seek services into our provinces. The other one is health sciences training. Our province also train, your nurses are trained, your doctors and others are also trained. So the budget also caters for training. The number 7 will be healthcare support. Your laundry services, your food services that are coming when our patients are admitted. They are also catered for by this budget. The last one will be health facility management. So the budget also is designed to cater for maintaining our health facilities within the province. Our hospitals, some of them are very old, so they need to be refurbished now and then so that they are improved, although we do have some new hospitals. So this budget caters for all these 8 programs. And now we've got COVID-19 that also came to visit us, at least from March last year. So there is also a catering for this problem that we are having. That is why we plead with our people to stay home, to reduce the overload that is currently happening in our hospital. So the Department of Health is doing its best even now to do the jabbing. People are getting their jabs because the Department of Health has budgeted for people to get their vaccines. Let me also share with you, there are people from other provinces, because this Department of Health is trying its best to ensure people are receiving the vaccine. They come, they get their jab here, and the department cannot turn anybody away when they come. Currently we are giving the elderly people, or people from the nearby, they come and say, I came for my jab, yes, I'm registered. Then they will check in the system. If you appear, they will give you. They are not going to say, Madibeng is not very far. Why don't you go to, it's northwest, but it's just across the road. So the department has catered to ensure that everybody who visits these facilities, they are getting help all the time when they need. So we think the budget is sufficient to be implemented to address all the issues of our people. Thank you.
All right, and as you were presenting, the question that was in my mind, and I think that's in the minds of many people in Gauteng, the Charlotte Mateke story. The big challenge that we're finding over there. Is there something that you as a committee are doing about it? Are you holding the department responsible for that and making sure that there is movement in that regard? That would be one question from me. And in terms of the COVID-19 jab that you just highlighted, the speed at which people are vaccinated, as a committee, do you have anything to do with that in terms of trying to speed up that process? Because those are the two main questions that I have no doubt are in the minds of the people of Gauteng.
Yes, thank you very much, Hector. The Charlotte Maxeke Hospital was affected by the fire in April. The role of the committee is also to visit these health facilities. We've been to Charlotte Maxeke 2 weeks back, Friday before last, to go and check what is going on. Why is it not getting opened as a committee? So on arrival, we have learned that at least the oncology department is going to be open this past Monday. However, the leadership of the province also met with various stakeholders to ensure that this hospital is getting opened. So there are other sections of the hospital that were opened this past Monday, so that it is offloading a workload that is now being given to other health facilities in our province. The oncology was working very well until the fire. However, the department should be very careful to ensure that there is a lot of compliance so that we avert another emergency in the form of the fire. So Charlotte Maxeke is gradually getting into operation. I can confirm that at least oncology is now was opened this past Monday. So the rest of the hospital will be an ongoing process to ensure that it is operational. Now, with regards to the jab that is being received, yes, we have encouraged the department to at least get more vaccinators. Our people should also know that this was not a plan, but because of the COVID, at least this team that is vaccinating, there are facilities. I may not give you the figures now, but there are facilities that are giving these vaccines. And with the report that we have received, our people are happy because they are getting it. I would not speak for Department of Basic Education in terms of teachers, but there is also an increase so that our teachers are also getting a vaccine. All this workload is given to the Department of Health because Department of Education will not be able to do what the Department of Health is going to be doing. So you can now see the workload that is now coming into the Department of Health to continue with this work before COVID and to do the new work that is coming because of COVID. So the speed is there because at least I think the numbers are increasing every day. We also encourage our people to go and get the vaccine. They must not listen to misconceptions about the vaccines because there are few people who are listening to stories, and when they realize that Mr. So-and-so went to get it and she's still alive, now they start to come up and they also cause problems because the dates were given, then they miss them. But when they come, they are not turned away. Thank you.
Thank you. In your report right now, the last part of your report on your findings, recommendations. Do you want to go back there and just give us what are your major findings as well as your recommendations to the department?
In terms of budget spending.
Yes, in terms of the budget spending, yes, ma'am.
Yes, where there was underspending, we normally will also give the department, because remember we are holding the department to account for all this money. So we even give them to say, by this period, we want you to tell us what are you going to do. You must tell us what are you going to do to address all the issues that were not addressed, because they will give us targets to say these are the targets that we are putting and we are going to achieve them. But if there was no achievement, there are always recommendations from the committee to say, and these recommendations are set aloud in the house sitting for everybody to can see that the committee is not happy on 1, 2, 3, and there is this expectation by this period that you must have addressed this by this time. So we've got our role is not to handle the department with white handkerchiefs. We want to see services to our people. Hence, we will say, for example, this is June. We will say by the 2nd of July, we need to, you must tell us why you didn't do 1, 2, 3. So those are the recommendations that the committee will be giving to the department to say this is what should happen. Thank you.
You are welcome, Honorable Dr. Rebecca Paladi-Dikhamela. There are already questions for you from the viewers on this webinar right now, others from the Mail and Guardian YouTube channel, and others watching on this channel, but we will deal with those later. Let us move to the next chairperson, who is looking at the next big budget, next biggest budget according to my research here. So you're getting, from what I'm seeing here, how much was it? 50 billion. And I'm talking about Honorable Matume Chilwani, who tabled the committee's oversight report on the detail of the Gauteng Department of Education Budget Vote 5 of the Provincial Appropriation Bill 2021. Now, sir, we're going to give you an opportunity, because also it just so happens that today we're having two departments which are always in the spotlight, given the things that have been happening in the media. Honorable Dikhamela, I just went past the issue that was so much in the news sometime last year, you know, that led to the MEC being fired. I just left it for now. Maybe it will be raised later to say what is it that you guys managed to do, or were you responsible for making sure that that was rectified. Now, in this one as well, Department of Gauteng, there's been a lot of issues. The members of the public very angry with the sanitization apparently that happened in the schools, and the amount of money that is looked at. So maybe that will also come up here. I don't know. Let us give you, Honorable Matume Chilwani, an opportunity to present your report.
Thank you. There's a bit of a feedback. Somebody was mute.
Yeah, there's a noise. Somebody, I'm not sure whether it's my ear alone. I think Chairperson is correct. There's a feedback. Somebody's mic is not off. I'm not sure whether it's from the studio or from.
Let me switch off mine, but I also get the noise.
Yep.
Yes, thank you so much for that. So I was also getting the noise, so I wanted him to start first just to establish where it was coming from. I'm going to switch mine off after this, and then you can proceed, sir. Let's hear.
Yeah, thank you. I think it was the mics. Yeah, we also, well, firstly, let me appreciate the opportunity that you Mail and Guardian and partners have given us as members of the legislature, and also to greet your viewers here. I can see there are about 22. If it's the right figure, and our listeners on radio. The allocation that the department received, as a committee, we found it adequate to cover the critical aspects that need to be covered by the department. The 7 programs. There has been some increase in certain programs, and there's also been some decrease in certain programs. As you know, that COVID has impacted on the budgets of all departments. However, in the current financial year, the department was allocated 53.4 billion for the financial year. I know it sounds a huge figure in most cases, but majority of it goes to salaries. That's about 65% of it goes to salaries, and those are generally in program 2 takes most of the budget. There are 7 programs. Just to give an overview of the 7 programs, the first one is the program 1 is administration. Then there's public ordinary school education, and you've got independent school subsidies. That's program 3. Program 4 is public special schools education. Program 5 is early childhood development. As you know, it moved to education, a certain portion of it, not entirely. You have program 6, that is infrastructure development, and you have program 7, that is examination and education related services. In these programs, the key programs that takes majority of our budget, as I've highlighted, is the public ordinary schooling education that takes majority of the budget. In program 1, I'll start with program 1. There was an increase. This is the administration. There has been an increase of about 300 million, from 4.2 to 4.5 in the current financial year, which amounts to about 8% of the budget, or 8% increase. Program 2, as I said, takes about 65% of it, of the budget, which amounts to where's the figure here? Which is about 35 billion, goes to program 2. Program 3 is independent school subsidies, which is about R1 billion. These are schools that the department subsidizes, the independent subsidized schools. Program 4 is a very special program. It's a public special school education. These are our special schools. There has been an increase in the current financial year. Yes, it is a significant increase. Early childhood, equally, there has been an increase in it. There's been a decrease, in fact, in this current financial year. These are the areas where the budgeting has been cut. But it like I've said in my opening statement, that it is adequate to meet the current financial year demands, despite the cut because of COVID and infrastructure development and what you call this, examination and related services. So in essence, the budget as a committee, we can't say that it's we're very happy. Of course, we would love to see more money be pumped in education. As you know, that it's a very important sector. Education look after 2,271 schools with almost 2.4 million learners, which is quite massive on a daily basis. And we currently, there's in public ordinary schooling, you are looking at about almost 1.6 million who are on school nutrition program that needs to be fed every day. So the budget itself, although it meets the demand to move forward, but we feel that it could be more, especially with regard to the infrastructure backlog. As you know, we generally have every year we have the problem of enrollment that you know about for grade 1s and grade 8s, the backlog, and that's because generally it's infrastructure, you know. And when I say infrastructure, we need more schools. If I would give an example of the number of learners who have commuted into the province, we're looking at about 120,000 learners who came into Gauteng in this current year, academic year. That's and if you look at an average school, and every school must have 1,000 learners, so we need over 100 schools to really cover the incoming, the migration into the province. So the budget itself, it's enough, but it could be better, more. We advocated for an increase, especially for infrastructure, because I think that if we build more schools enough and quick enough, we should be able to meet the standard. And also, there's also an improvement which we are happy about with the investment in the teacher support material, LTSM program. And this meets the programs, the strategic programs of the department. For example, the smart schools that will require certain infrastructure changes or development. You have the technical schools, which is an aspect that as a committee we've taken it up as one of the key programs that we must focus on, as well as special schools, because we think there needs to be more special schools. There is a huge backlog, although the department has done well to really reduce it, but the backlog is there. And when we found within the system, you'll find that some learners do need to go to special schools, but they are in ordinary schools. And those are some of the learners that are currently probably struggling in school. Maybe you can say the child is not smart enough. You get to the community, hey, what failure? Not what failure, the child maybe's got certain challenges and needs a special school to really begin to take time, because some children need more attention than others. Those are some of the realities that we face. So there needs to be a greater investment there. And more important, schools are social scenes, are community scenes, and there needs to be more investment with regard to extramural activities, because a youthful mind must be active. So there are certain areas that we feel that the budget could talk to more strongly, but in holistic sense, we are happy that it is adequate for us in the current financial year. We're hoping in the readjustment, maybe there will be some significant increase so that there is a focus. But those are the areas that I thought I should share, that as a committee we reflected on, and we thought that going forward we will lobby our colleagues in health to allow us to take a bit money from them, so that we can, we've got Honorable PC there who can begin to advocate for us, and let's give education a bit more than health. After the pandemic, that is, because now the pandemic, now we take everything. Yeah, but overall, that is how the allocation stands for the current financial year.
Thank you, Honorable Matume Chilwani. The two things that you highlighted, and I know this is one of the sore points in Gauteng. At the beginning of every year, it's almost the same story, and it thus appears as if the department did not plan properly. So when you're looking at their APPs, and when you're looking at this crisis that we experience every year, and you saying there that you are kind of satisfied that the budget also, covers for that, because that's an issue that requires infrastructure. But when you are stuck with thousands of learners who suddenly appear in Gauteng, so are you saying that emphatically that the department is fully able to deal with that, given the budget that you have, looking at their APPs?
Yeah, in the interim, yes, we do believe. Look, it's adequate to me, but however, there could be more. Like I've said, because of the migration, because our biggest challenge is migration. We could say we are victims of our own success. In the sense that if you look at other provinces, the parents are moving their children to Gauteng with the belief, and which I say they are correct, for better education within our province. So we are victims of our own success, and also, so that puts pressure on the system itself. So, but generally the department does place all learners, like even in the current year, all learners have been placed, those who come, but according to the records that are before us as a committee, on the department, all learners are placed in this current academic year that had applied.
The question that will go to all of us today, the issue of the current crisis created by COVID-19. We heard the president saying that by this Friday, all the schools must be closed, but also the inoculation of all the educators. In the budget, is there anything that has been done to make sure that the schools are safe, the children are safe, so that they can be able to continue should we be back to a lower lockdown level?
Yes, definitely. In fact, I know that if the problem with inoculation of currently of educators has been the lack of vaccine itself. I mean, within 3 days, the allocation that was given to Gauteng was finished, so they had to turn up the system and wait for the vaccine. And but in terms of inoculation, definitely, if there was the adequate numbers, Honorable Dikhamela, that I can tell you by Friday latest, they would have inoculated all the teachers, because quite a number of teachers we have received complaints as a committee that we're here at the center, there's no vaccines, and it's something that we have taken it up to say, but this, we need to really hurry up with this. And to be honest, all teachers are really enthusiastic about the vaccine. There was that scarecrow put about the vaccine that it's gonna do this, it's not gonna do it, No, actually, the uptake of the vaccine by educators has been more than impressive. Probably Khamela can attest to it, and also the reports we've been receiving. So we are certain, and the protocols that are put in place, the standard operating procedures that are put in place in our schools have ensured that the schools are safe, And the truth is, your child is more safer in school in most cases than roaming around in the streets in the community. Schools are safe spaces, schools are controlled environments. And so that is one of the advantages why children should be in school. So, and schools have standard operating procedures from as you arrive or at the gate all the way through. I mean, in terms of PPEs that you also asked about, yes. The PPEs are adequate. We've been to schools. We generally do unannounced visits to a number of schools. To date, we've never received a school that we don't have a sanitizer, we don't have PPEs, we don't have masks, we don't have all this necessary equipment for ensuring that schooling is safe and the virus is contained. So in most cases, the virus is brought into the school as opposed to from the school outside. Now, with regard to that earlier question around the fumigation of schools, we are waiting for the report from the SIU whether and to get a sense. But the committee did have an engagement with the department about it, and we were assured. Definitely, we should expect heads to roll. I think they were consistent. We're not mincing our word. If there's wrongdoing, we don't want to negotiate. We're not interested in that. We expect those who are responsible to be acted upon, because you cannot take advantage of such a pandemic. I think even if you are evil, you have gone beyond the level of Satan. You are his leader now. If you think about having looting in a pandemic when people are trying to survive, people are trying to live, you are thinking about your pockets. So the committee were unequivocal about that. We are very clear, and we've been very clear with the department that we expect action at the conclusion of this matter. The first preliminary report has come out, and it's quite sad what we have said. And we expect that upon finalization, we expect some form of action, and we will get it. The MEC has been very frank. I mean, in all in all, every time he was able to address, whether it's media, and he's been saying that there will be action. So
okay,
let's be patient. There will be action. Thank you.
Thank you for bringing the public of Gauteng into your confidence about that matter, because it's a question that's out there and that everybody was asking, and it was bound even if it was not me asking it, it was bound to come out from a member of the public who are watching via the Mail and Guardian YouTube channel, as well as this platform that we find ourselves on. It is the Budget Vote webinar series. It's part 3 of this. We started on Monday, and in conversation with the 3 chairpersons from the Gauteng Provincial Legislature, which is a sponsor of this series of conversations. Now, we are going to read out the questions later. Keep them coming. I see there's a lot of questions already popping up on this platform. We are going to read your questions to the honorable members of the panel this evening. Right now, let's give the final opportunity to Honorable Joe Mpisi, who is heading the Finance Portfolio Committee. He's a chairperson thereof. So when I looked at this basically is looking at everybody's budget, basically, in that the Gauteng Treasury is the one that controls all the budgets of all other departments. So this portfolio, we could boldly say that it's the most important one, facing the most difficult challenge, that 143 billion, looking at it like a hawk and making sure that every cent is spent to make sure that we alleviate poverty in this province, we deal with inequality, and there is job creation. All right, so we just once again want to acknowledge the of the public who are listening via EKFM, Legua FM, Westside FM, and Cosmo FM. So there will be questions for you. There are questions for you already, honorable members. But first, let's give Honorable Joe Mpisi an opportunity to present his findings of this report.
Thank you very much, Hector, and good evening to colleagues and to the people of Gauteng who have joined us in various platforms. One of the things that I must appreciate, Hector, is that the budget of my department that I'm doing oversight on is very small. It's about 754.8 million. Looking after billions and billions of rands, you can then tell. Because all the departments, we do oversight on them, and we make sure that this money is accounted for. We actually our budget is having 6 programs, and these programs are administration. The other one is the sustainable fiscal resource management, the financial governance, the provincial supply chain management, and the municipal finance governance, and the Gauteng audit services. And all of these programs, we divide that money according to what has been given. But I must say that when we started in 2019, we were greeted with much fanfare, you know, as it undertook the Gauteng through the Gauteng Growing Gauteng Together 2030 strategy. And that strategy was meant to make sure that we improve the lives of our people in the province. So we, as the portfolio committee, we are also involved in making sure that we do scrutiny in all of these other departments, how they spend, how they are spending their budget, in which areas are they spending this budget, where there are misunderstandings. We are the first ones to actually inform the department to say that their departments are not doing well. We engage with the MECs of the department politically, together with their heads of department, to make sure that the money that we have voted for is the money that must be spent according to the APPs, and there are no changes that will just be made in between. We know at some point we had to engage with 1 or 2 departments who just willy-nilly transferred money from one program to another, and we managed to stop that. And our main focus also was to make sure that all of the Gauteng supply chain management in the province adhere to the rule of law. And that is why we encourage the open tender system that has been adopted by the province. And I must also indicate to you that when we took over in 2019, we realized that there were challenges in our supply chain management, and together with the what you call the chief finance officers offices. And in Gauteng, since 2019, we have expelled that through our recommendations, about 7 CFOs either resigned or they were actually asked to leave. And then we also made it a point that there is a reform in the supply chain management in our province, which was influenced by our oversight work, because that is one thing that we are actually doing. But we are also involved in making sure that capital projects that are budgeted for, those departments that have budgeted for those capital projects in a financial year, those capital projects are delivered. When they are not delivered, we have what we call the GPG wide towards the end of the year, where we check all the departments and how they're operating. Because if a department is spending less, they must give a thorough explanation to ourselves to say why they are not spending their budget. So it is our responsibility to make sure that where are the ears and eyes for the people of Gauteng. And you would know in the last financial year, where the challenge Hector of departments not spending because of COVID. I must say that some of us were very disappointed that some of the departments did not actually even reach 80% of the budget spent, but we have managed to correct that this year, and we are taking the departments that are not performing well in terms of spending. The Auditor General actually said to us 5 departments which were not actually spending thoroughly. It is the Department of Infrastructure Development, Department of Roads and Transport, Department of Health, Department of Education, and Department of Social Development, which were eyed by the Auditor General. And then we said that we are definitely going to put our eyes on them. And we have engaged with the HODs and the MECs of those departments to make sure that money is spent properly, and we need to make sure that the departments spend according to their APPs. Another issue that is the most important thing for us as the portfolio committee. We look at the process that we follow. We don't just do this for the sake of doing it on our own. We are actually interacting with our people before the budget is passed. We go through a thorough process where the community of Gauteng do participate in this particular process, because we can't just adopt a budget in the province without the people of Gauteng. And we have encouraged each portfolio committee to also engage with their stakeholders on issues. For example, you look at health. Health will meet with all their stakeholders to inform their budget so that the department can plan properly about the needs. But also we have encouraged departments to have what we call the contingency funds. For example, we have seen now Charlotte Matlaka was closed, but because of the contingency funds that were set aside, working together with the Department of Infrastructure Development, that was done because of the contingency funds that were set aside to respond to the challenges that might arise in between. Because remember, we're modernizing Gauteng as I close. We're modernizing Gauteng, and as we modernize Gauteng, we may be small in terms of our geographical spread, but we are the heartbeat of this country, and we must make sure that all of us adhere to the rule of law. And I must also indicate that we have also made it a point that we are not going to tolerate corruption, and all the investigations that are underway currently with the SIU, we are awaiting the reports ourselves to make sure that all the recommendations by the SIU are carried out and are implemented to the latter. by the department, by the Premier's office in our province. So that is what we are doing, and we are doing it very well, Hector. Thank you so much.
I saw the Premier just before this live broadcast as I was preparing myself. I think the Premier of, not the Premier, the MEC rather, of
Yes.
Department of Education, going live, going on Facebook, posting that he was cleared of the 30 million overnight tender that was approved, and we are so happy, you know, cleared by the Deputy Public Protector. I don't know if you have seen that already, but it was just a breaking news story that I saw about 30 minutes before this broadcast, and I don't know whether that means that then somebody then has to account, somebody has to be made to answer as to what happened to that 30 million. Now.
Yes.
As you were presenting here, you mentioned something about that public participation and its importance, and I picked up something in your report, and allow me to just go through this. It says, you know, there wasn't enough of that because of the cumbersome process of mobilizing stakeholders to participate in meeting virtually. The portfolio committee did not invite stakeholders to meetings to observe committee proceedings and later make verbal submissions in line with the Gauteng Provincial Legislature participation mandate, you know, part of what we are doing right now,
Yes,
and the Constitution of South Africa. So how does that fit in with what you were saying earlier on, Honorable Joe?
I think we have corrected that statement in the sitting. We have met with our stakeholders. One of our stakeholders is Salga, that attended, and the individuals who come from the public also, who also participated, because we did it visually. Some of our people don't have data, data to log into our visual meetings, but we have met with our stakeholders, and we have a contribution from our stakeholders, including those that are actually doing work for civil society on finances that are spent in housing. So we have done that. The only thing we did not do that physically, as we normally do, because of COVID-19, and so we had to respect the COVID regulations, and we did not want to actually put the lives of our people in danger. So that is what we have requested, because we have even requested inputs, and I remember I was in one of the radio stations where I was actually requesting the people of Gauteng to actually do submission to our officials through emails and so on, and then we have received very few, of course, but we were happy with what we have received, because it managed to assist us to deal with the approval of our budget.
All right.
And on the 30 million, Hector, sorry, on the 30 million scandal, I'm happy that the matter was handled by the Premier's office. I'm awaiting the report because myself and Dr. Khamela, as a member of my portfolio committee, we are waiting patiently for that report, and we are happy to hear that the MEC has been cleared. And we have always said, anyone that is found to be on the wrong side of the law must face consequences. We need to know why that tender was advertised during the December holiday, and why was it not done properly. It was done only for open on Friday, closed by Monday. So we want to know. That is why we are not going to leave that hanging. We are going to follow that up. Currently, we are on recess, but we are going to definitely follow that up with the MEC and the Premier's office. And we want to make sure that those who are involved are actually taken through the process of DC. If need be, they must be arrested.
And does that also apply to the side of the Department of Health, which was very much in the news? We know that the MEC eventually was removed, but then are there other officials who were held accountable, because it was a lot of money? And talking about infrastructure programs, you know, somebody was asking on Facebook the other day that, you know, a year later after the pandemic, not even a single hospital built. What is happening in this province? Where are the monies going to? And I saw, as part of your concerns. You raised a concern about the GIFA. You want to tell us a little bit about that and the recommendation that you came out with? Because I saw in your recommendation, you did not even put the date as to by when should the business value proposition be brought to you.
Just going through the recommendations.
Yes.
Hector, we had a problem with GIFA. Their performance, the portfolio committee raised a very serious concern about the performance of GIFA,
Yes.
because you know that we have requested that they must submit their strategy on all the projects that they are set to be involved in. And I must highlight the fact that members of the portfolio committee raised these issues, and we have raised with the MEC that we are allocating money to GIFA. GIFA is not a standing alone entity. It's an entity that is linked to the Department of Treasury. And if they are not going to perform according to the expectations of the APPs, it is something that we have to review as the portfolio committee working together with the government to make sure that there's clarity around why this entity is not performing optimally. Remember, that entity is given a responsibility to make sure that it assists the Gauteng government in making sure that capital projects and projects that are needed in the province are carried. It is the one that links us with the private sector and making sure that all the capital projects, for example, if we want to build a school, GIFA must work with the Department of Infrastructure Development as well with the Department of Education. But their role is to make sure that it negotiates on behalf of the state a better deal than the money that is normally charged as you go to an ordinary open tender. So it is something that we have realized that over the past 2 years, we haven't received satisfactory reports from GIFA. Hence, there was a call also by members of the portfolio committee to say the Gauteng government must review whether we definitely need this entity or this entity must be given directly to the Department of Infrastructure, because it has a lot of challenges. The spin-offs are not been seen, and the report that we are getting is like a cut and paste report. We are definitely looking into it, and we are working with the MEC to make sure that we have a turnaround strategy around it.
For those who are watching on YouTube on the Mail and Guardian channel and also through various radio stations, GIFA is the Gauteng Infrastructure Financing Agency. Now, after your presentations, there have been people who are asking questions. I don't want to hog this and be the only one asking you. Let us, the whole purpose of this exercise, this budget votes webinar series, is to give the members of the public so that you can be able to fulfill your mandate of public participation, hear from the public. So we do have a few questions already, and I think a few going to Honorable Dr. Rebecca Paladi-Dichamela. The first one that I'm seeing here, Sable Otterstrom, been with us from Monday. Thank you so much, Sable. It says, NHI, how far are we, and do we know how we can register for the NHI? That's question number one for you, honorable member. Then the number two question from the same member who's here with us. Actually, she has three. Sable has got three questions. The second one is the vaccine free, though, everybody, or do you have medical aid to get it, or do you have to have a medical aid to have it? The clarity needed there. Then number three, what is happening with Charlotte Mateke Academic Hospital after the fire, as this will reduce and cater for more patients there? We need more jabs than more lockdown, as we can have the vaccine. This will reduce people being infected. I think this one was answered as we were having conversations, but if you want to reassure Sable, you may do that. So these are the questions to you, Honorable Dichamela.
Thank you very much for those questions. I will start with the vaccine. Vaccine is for everybody in South Africa. There is nobody who will be not given the vaccine, but you need to have your ID, you need to register with the system, and after you have registered, often you'll get an SMS as to where you can go and get the vaccine. But elderly people, those who do not have the opportunity to register, because some of the elderly, they don't have the smartphone. They visit their nearest health facility, especially the clinic where they are giving the vaccine. Often our professional nurses, they register them so that they appear in the system, because it's very controlled. It must be known that so and so got the vaccine at least, and then if they have to come for the second dose, they will be known that Miss or Mr. so and so got the vaccine. This is now the second dose. So nobody is sent away. You have to register. If you cannot register because of challenges, still you need to visit your nearest facility. They will assist you, and often you get, if you are registered, you already get your vaccine before you go. So it's for everybody, whether medical aid or not, you get the vaccine. On the issue of the Charlotte Maxake, I have already responded that this Monday, this day before yesterday, parts of the hospital are in operation, particularly the oncology, which was also closed because the fire was mostly at a certain level, not in all parts of the hospital. So those parts that were not affected, some of them are gradually being opened, and there will be processes that will be followed because the hospital has to comply with occupational health safety measures. All in all, there are new rules in terms of OHS that need to be applied for all health in our province. And on the issue of national health insurance, the process, I think, was halted by the arrival of the pandemic, coronavirus infection, because as a province, we also, we did, I think, we were the last province to do public participation together with the subcommittee national level, and we did public participations. There were submissions from the people in our province that indeed we need universal health coverage for everybody, irrespective of social standing. So at this stage, the submissions went to the Parliament, to the portfolio committee at Parliament, received the submissions, they are captured, so it is operating in phases. So that phase of public participation is gone. So we will wait for the next phase because it is championed by the National Department of Health as we are supporting whatever is coming. But otherwise, it's a program that we all welcome it so that everybody should receive care without a big pocket or small pocket. Thank you.
Unmute yourself, Hector.
I think you are muted, Hector. Unmute yourself.
Unmute yourself.
Oh my God, sorry about that. It was a question of trying to make sure that we minimize. There's a little feedback that I was getting. My apologies about that. Thank you, Honorable Dr. Rebecca Paladi-Digamela. For that, and I'm hoping that Civil is answered. Keep on asking those questions from different platforms because the chairpersons are here to deal with those questions as part of this mandate of public participation. So somebody who was asking that you know, I think they were comparing us to China when it was publicized that they managed to build a hospital. I don't know whether it was said that within a month or 2 months or whatever. And people asking that we are within there's a pandemic happening, and yet our health facilities are not really enough to cope with the number of people who are coming in, and seeming as if people expected that there would be something built already by now. But we'll come back to that later. Nkatazo non-Joanna. Nkatazo non-Joanna.
Just a minute, Hector.
Yes.
There is a lot of disturbance, and if you were talking to me, I didn't hear you very well. Even my response to the questions, I just heard some words, but there is an echo from your side where you are not clear. You are talking, but there is no audibility, which is very clear.
There's a sound in the background. I think it's something that the technicians must look at.
Because where I am right now, I'm alone. Yeah, it's very quiet. I looked for a very quiet room.
No, it's better now, Hector.
Is it better now?
Yeah.
Thank you so much. I do apologize for that, because I was wondering what is happening, because I'm alone where I am. All right. Let me just say that thank you for that response, Honorable Dr. Rebecca Paladi-Digamela. I was saying that there's been a concern that, you know, this pandemic, we knew that we are right in the middle of it. And wouldn't there have been a way that you could have held the Department of Health responsible to that at least a hospital is built? And I think it's where people were comparing us to China, you know, those reports that said there was a hospital that was built. I don't know whether it was over a week or a month or whatever, but we will come back to you around that. I would like us to, at this point, to go to our streamers, and we have Nkatazo non-Joanna. He says, afternoon leaderships. I want to know about the budget of human settlement. And I think Honorable Joe Mpisi, since we are looking at all the budgets, this will be coming to you. I want to know about the budget of human settlement, how it is divided. Is it divided by population or by people who need housing? If it is divided by people who need housing, by housing, why people still waiting for houses? That's one question for you. And then may I say also, Honorable Sotaile.
Sorry, can you repeat that question?
Okay, all right. I want to know about the budget of human settlement. How is it divided? Is it divided by population or by people who need housing? If it is divided by people who need housing, why is it that there are people who still waiting for houses? That is the question. And then, as we are preparing for that, Honorable Sotaile, oh my goodness, I know Honorable Kanyele was here with us on Monday from Scopa. He says, are there instances where departments do not spend some of their allocated budget? I think you did allude to that in your presentation, Honorable Mpisi. What impact does that have on services delivery? What is the role of portfolio committees in this regard? Because that's a worrying factor, knowing that there are so many needs in Gauteng. You would think that actually departments run out of money to render services that are so badly needed in this province. So I give both to you, Honorable Joe Mpisi.
Thank you very much, Hector. I was just going through the issues that you have raised now. Look, as the portfolio committee, one of the things that we normally do, I will start with the issue of Honorable Kanyele, the impact on service delivery due to lack of spending. Indeed, it does have an impact. As you know, Gauteng is too demanding, and our people are not just sitting back and say, no, we are not going to wait. They march every now and then to government offices for service delivery. because they want their government to deliver as promised. Remember, when you adopt this budget, you would have gone through a process of engaging with the public. And what you say in the public, they will hold you accountable for that. So it is indeed causing us problems. If you look at, like I said, in the last financial year, most of our departments did not spend money as allocated to them. Yes, we understand the issue of COVID, but we could have done better immediately after the lockdown levels were lowered. But I can tell you now that we did not achieve the objective last year. And hence, at the moment, there's too much backlog of the needs of our people to be delivered. There's a need for schools, there's need for housing, and so on. And that has created a challenge. And that is why I was saying that the Auditor General actually indicated to us to say these departments that are actually not spending, the 5 departments that I've spoken about earlier, these are the departments that are actually dealing with social issues that our people need. Your housing, your health, your education, your transport, your social development. And these are the areas which are supposed to be actually implemented according to the APPs that were adopted by the department together with their portfolio committees. That has created problems for our government. On the issue of human settlement.
Honorable Joe, before you answer that next one, I'm just wondering, when we look at the beginning of the 6th administration, 2019, 2020, and 2020, this underspending, the underspending that has been, has it been going on even before COVID, or is this just a phenomenon that just happened during COVID?
No, it happened in other departments, but it was worse in the last financial year because of COVID. And I can tell you that from where we are sitting, we have actually requested most of the department to come and explain themselves, to come and tell us where are the bottlenecks. Because if you look at our quarterly report to the House in the legislature, we have made recommendations on each and every department that hasn't spent. And we have raised these issues even before the Auditor General gave us their reports. And if you look at what the Auditor General said about some of the departments that we have spoken about, these are the departments that are actually culprits of not spending because of the needs of our people. And that has created lots and lots of problems. And as a result, it has made it an issue for us in the province not to actually respond favorably to the needs of our people. You look at the issue that we're looking at, and for example, if you look at human settlement, we have received 100 million a grant towards the end of the financial year last year. And that money was meant just to go and address the issues that are affecting our people, on top of the budget that was given to them earlier in the year, in the last financial year. And that 100 million was given to them so that they can then respond to the immediate challenges of settlement in our province. And then that money, we got it from national. And I must say that I'm still awaiting the report together with my team, so that we can then be able to say what happened to that particular amount of money. 2, the issue is that you don't have to be the poorest of the poor to receive a house. If you need a house, you go and make a request that you want a house, and you get into the list. But what we have seen in the province, and I must say this without being xenophobic about it, we have seen the growing number of demands. Majority of the houses that we have given to our own people in the province, those houses, majority of them were sold to foreign nationals by the people of South Africa. And that has been proven. The study has been done. And you ask yourself, why our people are doing that? We don't know. Maybe it's because of poverty or because of lack of employment, I am not sure. But now I know that Human Settlement has now passed a law that no one is going to sell a house that is given to them for the next 10 to 15 years, because they have to still stay in those houses. But unfortunately, the houses that were given to our people have now been given to people who are not South Africans. And that has created a lot of challenges. And again, we look at the population that is in demand of houses. The Department of Human Settlement requests the allocation of budget according to what the demand is. If you look at their budget, I don't have the exact figure, but I'll give it to you before the end of the show. We say to them, because Human Settlement alone, it's having a lot of billions that they are taking care of. A lot of billions to make sure that there is a delivery for houses and the settlement in our province. Just I think before the show started, you and I spoke about the Johannesburg South, where there's a land grab by illegal people, where that area was eyed for development. And we can't do that now because people have just put checks in those areas and the department can't deliver houses in those areas. And it is a problem that we have to address. And I think Gauteng Department of Human Settlement will definitely have to work very hard to make sure that we find a way of resettling these people so that development can take place. Because that area where they are now, it is the area where houses were actually supposed to be built in those areas. Some of our people are even building in the wetland, which is going to be a crisis situation for our people. But I can tell you that our colleagues in the Portfolio Committee of Human Settlement, under the leadership of Honorable Diale, they are looking at the impact of their budget and what the APPs of the department is saying in delivering those houses. And definitely we are going to make sure as a Portfolio Committee that those houses that were promised to our people are delivered. I know that the Gauteng Housing Agency also is working with the department to make sure that they respond to the needs. But we must request our people to be patient. But people, when they are given these houses, they must not sell this house to foreign nationals because they need money. These are their houses. This is what their kids need. They can't give it to anyone else except to keep it for their children. Thank you.
Thank you, Honorable Joe Mpisi. There's a question for you, Honorable Chilwani, Honorable Matume Chilwani, about feeding schemes. During lockdown, what happens to those learners who are on feeding schemes? That's a question to you. Sybil, once again saying thank you for that acronym meaning. This one, foreign nationals, if we need ID, they live with us, then what for the vaccine? I don't really understand how Sybil typed this, but maybe the gist of this is that do foreign nationals need an ID to get the vaccine? Let me know if I interpreted your question correctly. And then, what are the mechanisms in place to reduce or eliminate irregular expenditure? I think Nkosazana and Ndlovu, if you are listening to Honorable Mpisi, he did try his best to cover that. And there's a question on e-tolls, which I don't think falls within the two chairpersons. We're looking at education and health today, but if you want to say something about it, Honorable Joe Mpisi, since you're the finance portfolio committee looks at all of these departments, you might want to touch on that before we finish at 7:30. Okay. So, Honorable Matume Chilwani, feeding schemes.
Thank you. With regard to feeding schemes, yes, indeed, they will be fed. There will be a feeding scheme available during the lockdown. In fact, there is a court order in that regard. how it will be categorized rather. It will be there'll be three categories. Okay, can you mute? Okay. Yes, as I was saying, there will be three categories. The first one is we'll be giving food parcels rather. The department will be issuing food parcels to those three categories. The first category is child-headed families. They will receive, and there will also be granny-headed families that are led by grandparents. Those children will also receive food parcels. And also poor indigent families, but basically we'll be targeting the department will target indigent families. Yes, there will be the school nutrition program will continue to run lockdown, but they will be issuing food parcels as opposed to being fed from schools.
Okay, thank you, Honorable Matube Chilwani. I was, there was a bit of crackling in your microphone. I'm not so sure whether it was on my side only, but if the streamers and the viewers on Mail and Guardian, our hosts, YouTube channel, and on this panel were able to hear you, I'd be happy with that, as well as on our different radio stations, which are EKFM, Lekwa FM, Westside FM, and Cosmo FM. Sean, I'm not so sure. I think we might have to check. My observation is that as we go over an hour, somehow the quality just goes deteriorating. This is my observation from the last 2 days. Now, Honorable PC, do you want to tackle? Okay, let's go to Honorable Rebecca Paladi de Carmela. The issue around vaccination. I think it came in. Do foreign nationals get vaccine as they live among us? Mostly does have passports.
I didn't get that question, but you are asking about the vaccine.
For the foreign nationals. For the foreign nationals.
Oh, for every person who has an ID will be able to register, and they will get their vaccine according to their faces. We've got foreign nationals who are residents in South Africa, and they do have IDs. They can also register because the system will recognize them. So they will get the vaccine because they are staying here. However, there will be a challenge with illegal foreign nationals because the vaccine is controlled and the ID is the only, currently, according to my understanding, is the only mode which will be used to register a person to access the vaccine. So you use the ID for a person, they start in the system, then it is known where are the vaccine. It's also a control measures for the vaccine themselves so that it is clear, it is known where they have gone to, because we don't want issues of a stolen vaccine or something. So that's why a report is captured every day for all of us to know how many people were vaccinated in a particular day. So the foreign nationals who are having IDs, they also register, they get it without any problem. Thank you.
Thank you, Honorable Dr. Rebecca Paladi de Carmela. Honorable BC, you want to tackle the ETOS one, or it doesn't fall within what we're talking about today, or you do have something to say about that?
Yeah, let me deal with that. I think we have a position as the province. We have said that the ETOS must be scrapped. It is a provincial decision, and that we are waiting for national to pronounce. But as a province, our government and our legislature have pronounced that the ETOS must go because they don't make sense for us in the province, and we don't have money to actually budget for such an activity. And the department under the stewardship of Minister Mbalula is actually promising us that they will soon give us an announcement about where are we going with the ETOS. Because at the province, we have reached that point where we said, no, it's not our baby. It must go. On other issues that I forgot to raise that, Hector, we have actually a date for GIFA to respond. It's on the 15th of July. They must give us a response. It's about their APPs and how they perform, and we need a detailed report about their status at the moment. Secondly, the issue of human settlement budget, I must indicate to you that the budget of human settlement is 5.9 billion, the entire budget of the department. 24.9 billion for conditional grants for all the departments. So human settlement does have enough money to can implement what they've promised the people of Gauteng. Lastly is the issue of the impact that human settlement has to do working with other departments. Remember, if I would just want to make one example, if you look at Snake Park in Soweto, that settlement, when it was formalized, the Department of Education, Health, and Social Development integrated a plan to make sure that that human settlement, there must be houses, there must be schools, there must be clinics, as well as the social development offices in the area. So that's what we need, actually. When we talk of human settlement, we're not just talking about only houses. We integrate these departments that I've already spoken about, because there is a need. And obviously, the houses are informed by the development and as well as the population that grows in the area. So the entire province, we have 5 regions in the province, and we have managers in each province of human settlement working on behalf of the province. They do a study every year about the population in the area or in the region that they are managing. And they submit that to the provincial office. And as a result, that informs the budget of human settlement so that we can then be able to adopt that budget. From where I'm sitting, I have no doubt, Hector, in as much as we have cut the budget of human settlement, it was in the previous year, it was about 6.2 billion, and now it's 5.9 billion. But that money, it is the money that must be actually spent to the last cent. We have told the MEC, we have told the HOD that that money has to be spent. We have told also the Department of Infrastructure Development, because the Premier said in his SOPA speech that for us to rebuild our economy in the province, we need an infrastructure rollout in the province. Through the infrastructure rollout, our economy will then be boosted. So we have said to the MEC Mutara that capital project that they have on the pipeline, all of them must be implemented. MEC Mamabulo, the same thing. We have told him that our roads are not in a good standard. Can they spend money to close the potholes and make sure that the new roads are built in the areas where we need? So that money must be spent. It is our responsibility as finance to make sure that each and every cent allocated to each department must be spent. Where there's theft or corruption, as my colleagues have said, we are not going to leave any person that is found to be on the wrong side of the law through corruption. That is why we have removed about 7 CFOs. We have removed a number of supply chain management chief directors in the province, because we are dealing seriously with the issues of corruption. We are the ones actually in the province who actually, when the PPE scandal started in the province, it is our portfolio committee that raised this issue to say, we are seeing a red light flicking a lot in the Department of Health. What is happening there? And we then requested our own MEC and the then HOD to come and report to us and tell us how is the money of the PPEs is going to be spent. And at that time, damage was done. Small businesses were given letters, wrongly so, by the then CFO, promising them jobs. Others were already given responsibilities for the work that they are not even qualified to do. So we are the ones who actually pushed very hard, and we don't climb on top of the table and say we have done so. But through the work that we do as an oversight, we have managed to save our province millions and millions of rands to stop a very, very bad tendency of corruption on the PPEs. And I want to agree with my colleague, Honorable Chilwane, that this thing of corruption, we cannot tolerate it as the public representatives. It must start with us. It must start with us. If one of us is found to be on the wrong side of the law must take its course and people must be arrested. Our officials have been doing a lot of damage as well without being properly managed by our deployees in various departments. So we have said to them, each and every MEC and the HOD and the CFO, if they don't take responsibility in managing and supervising their own people, we will red tick their departments and they must come and account as to why are they failing? Why are they failing to monitor the expenditure of their department? So our responsibility is huge. We are dealing with over 130 billion in this province annually, and that money cannot go to waste. Our people are struggling, and we must make sure that our government responds positively to that. And we have no doubt, under the leadership of the Premier, that we are going to turn the tide against corruption. Thank you.
Honorable Joe Mpisi heads the Finance Portfolio Committee within the Gauteng Provincial Legislature, which is the one that sponsored this series of talks, which started on Monday. I let you go on there because I was taking that's your closing comments, and I could hear that you were reassuring the province, the people of the province, that you are dealing with corruption and that you will make sure that there will be service delivery, and also that you are looking at this underspending that really I found so alarming as you are talking about it, and asking myself, is it due to incompetence? But we know that COVID played a little role, but it was there even before COVID. So we are happy that you have your eye on it to make sure that services are being provided, and that is why I let you go on there. Thank you so much for that. From the Department of Education, Honorable Matume Chilwane, well, he heads the committee, rather looking over the Department of Education. From your side, your closing comments, please reassure the citizens of Gauteng, in terms of what you are, the oversight work that you do, that they can expect schools or whatever. I don't know. What do you want to leave them with this evening?
Yes, let me start. I see there's a question from Stembiso Mosito. I could say that he's the chairperson of Magaliesburg Secondary School. We, as a committee, we are conscious of certain issues that are from that school. But
just hold on, Matume Chilwane. If I can just ask all other members to close their microphones. I'm closing mine right now. That distortion is still there from your side. I'm closing my mic so that we can hear you. If you could just, with due respect, just start again, sir.
Okay. Yes, I'm saying that I was looking at the question that has been brought up by Stembiso Mosito. With regard to the boarding facility at Magaliesburg Secondary School. I want to assure him that we are conscious of what's happening in that school, and we will be coming through as a committee as and when we open the legislature in the next quarter. We'll make sure that we do come to the school and really get a sense as to what are the other challenges that are there. But there are a number of issues that have been coming out from that school itself. A lot of allegations of malfeasance and what you call this, nepotism. So they're just stories that we've been picking up. And the last time the MEC went there and dissolved the SGB of that school. So there are a certain number of problems, but we are aware of them. We'll look closer, we'll come closer to the problem. But thank you for the question. All I can say for now in my closing remarks is that education is big. It's in terms of size, is the biggest, with over almost 100,000 educators that we have, over 2,000 schools. So it really requires everybody's hands on deck. The education relies heavily on SGBs, and those who are in SGBs here, we must say that we do rely on you to ensure that there's proper governance and management of our schools. And indeed, with regard to ourselves as a committee, yes, we've got our hands on the pulse. We are doing our oversight work properly. We are bringing the department to account. And what we can assure is that we don't mince our words. They know very well. If there are issues, we confront them as they are, and we expect a response and we expect action. And the key thing now is that we as a committee, we've also taken a different strategy of saying we want committable milestones. We don't want an answer. There's this thing of asking a question to the department and getting a response. We don't want those things anymore. We want a response and a milestone as to when that will be delivered. And in between, we don't want an end product. We need to know how far towards the end product. There are steps towards it, because in that way we'll be able to see progress. But if we wait and have an open-ended questions or open-ended concerns as a department, it really it becomes a talk shop exercise. So we're moving from talk shop, we're moving to action. There's no time. We want our children to be safe. We want our children to learn. We want our educators to teach. We want our educators to be supported with proper infrastructure so that there's proper learning and teaching in our schools. And we want to see improvement not only in terms of the number of matriculants, but the number of bachelor pass rates. That will gauge on the success of the work of our committee together with the department. The throughput rate, very critical. We see a number of learners coming in grade 1 and having far less in matric. That is a very concerning issue that we've been looking at closely. And so in essence, what we're saying to the people of Gauteng is that as a committee, we do have our hand on the pulse. We know what's happening, and we are really bringing the department to account. And it does not mean when you're a committee or an enemy of the department. No. We're not there. We are working together to ensure that there is proper quality teaching and learning in our schools. Our schools become safe, and we produce good citizens, global citizens from our children. That's what we want. Thank you.
Thank you, Honorable Matume Chiloani. And finally, we'll give the last words to you, Honorable Dr. Rebecca Paladi-Digamela, to reassure the people of Gauteng as the one looking over the budget, the biggest budget in the province, about what to expect from you going forward and what you will be doing to make sure that the services expected and rightly so by the citizens of the province do happen or are delivered.
Thank you very much, Hector. Our people in the province must be reassured that we are there to represent them, to ensure that the department is spending its budget according to the plans. Our people should also, by all means, remember that our health facilities are classified according to various levels. They must always start at the lower level of care, because if they persistently go to the higher level of care, they block space for people with a serious condition who deserve that space, because our constitution says they must not turn anybody down. But imagine a person with a small condition going to a higher level where somebody with a serious condition requiring that service. So the classification is not by mistake. If there is a booking system, our people will follow it. It will reduce overcrowding also in our health facilities. It will really assist because it will be a good thing to do because you come when you are told at what time you should be coming. We will also reduce burnout that's been suffering by our people in the health facilities. So I would like to reassure everybody that it is doable if we work together with our government. Let us not drink and drive. Let us also, by all means, ensure we follow the non-pharmaceutical rules of COVID-19, sanitizing, staying home, social distance. Our health facilities are full now. There is no more enough space to care for new people who will be coming with infection. Let's do our best. Our bid is doable. We can all do it. Thank you. Unmute. Hector, unmute.
Thank you so much, Honorable Dr. Dikhamela. You're talking about our facilities which are full. The plans to build the hospitals. I did not pick that up clearly in the report. I'm not taking you back, just to reassure people that there will be more facilities built, maybe in the current financial year. I don't know, or in the coming financial years.
Yes, there is a budget allocation for building of the new hospitals, and I can maybe perhaps to say there was also a mention of a Soshanguve hospital, and there is also Kyalami hospital, but sometimes there is a relationship between provincial government and national government for the building of such facilities. So the budget is prepared and it will come in. You must also remember our population is said to be 15 million, but we are more than 15 million in this small province. And I think the health department is doing its best, because if everything was all lost, we wouldn't see too many people coming every day to our facilities. So we are in progress in ensuring we've got extra facilities because of our large population. Thanks.
Honorable Dr. Rebecca Paladi-Dikhamela, thank you so much. Honorable Madume Chilo, oversight on education. Honorable Joe Mpisi, thank you so much, Finance Portfolio Committee. Thank you so much for your time this evening. Stembito Musito, I'm happy that Honorable Chilwani managed to answer your question about the Magaliesburg Secondary School. And I just want to thank everybody else who sent forth their questions, participating this evening in this series of budget votes webinar sessions. The last one is tomorrow, part 4, as brought to us by the Gauteng Provincial Legislature. And thank you, Mail and Guardian, for hosting these. We meet again tomorrow at 6 p.m. I just want to thank you all for your time.
Thank you, Hector, and goodbye to
Thank you. Good night.
Good night.
Good night. Thank you.
Thank
Bye,
you.
bye, comrades.
Bye.